Rosie and Dr. Paul Faine, thank you for joining us today on Real Parallels. We're really excited to have you guys on tonight. I mean, it is the end of the year, and I just want to say Happy New Year. And I'm glad it was really nice seeing everyone um, on our Zoom call, our family Zoom call the other day. It really made me kind of wax nostalgic for all of the real fun Christmas parties we used to have at your place. So thanks for showing that off. But more importantly, Lance and I want to just say thanks again for taking some time tonight and chatting with us about 2020 and what you guys have been up to.
Well, it's a pleasure to be here, and hopefully we can be somewhat informative.
Yeah. Well, Paul, you know what? Why don't you this is the first time you're meeting Lance, so why don't you just kind of like tell us a little bit about yourself and like the Cliff's Notes of Dr. Paul Faine.
All right. Well, I'm an emergency room physician. I've been in practice for 22 years. I work in the western suburbs around Chicago at a Northwestern affiliated hospital, Central DuPage Hospital. We see about 75,000 patients through our emergency room a year. So,
Whoa. Wow. Has that number changed in 2020, I should say?
maybe we're growing a small amount, maybe 3-4%, but not a dramatic change. So,
Oh, okay. Okay.
and
Well, I okay, go ahead.
Page County is, I think, probably this has the second largest number of COVID patients in the state right now. So I wouldn't say we're a hot spot, but certainly we're seeing a fair amount of COVID right now.
Yeah, that's another thing I was going to ask too. Okay. Well, now here's the funny thing. I dig this. Uh, your wife, my cousin Rosie, is a nurse who's sitting right next to you, and I know that at the beginning of the year she had started in the Rosie. You started actually in these wards, didn't you? Like actually,
I did.
uh, yeah.
Yeah.
I mean, like it was the COVID ward. It was just like a ward that was.
Like
Uh,
intensive care units in the medical floor that has all the COVID patients.
Whoa.
And
Now,
our clinic needed us to help them, and we kind of closed our clinic a little bit, so we had to go and help them out a little. So I didn't.
kind of like they just they shut down that part so you
Yeah,
guys could.
yeah.
Oh man.
Ours is
Uh
surgeries, so it wasn't mandatory for us to be open. So we had to open
oh.
COVID units for patients.
Yeah. No, we spoke to another doctor about that who mentioned that all those he spent 2 weeks kind of on the front lines after his Lance, what was it? It was just his area was it electrocardiophysiology. What is that?
Yeah, so it's
Onomatopoeia.
like no, the study of the electricity of the heart, and then they stopped all elective surgeries and stuff like that. So then his whole unit moved to the front line.
Yeah. So Rose, I understand that you're not actually on the front lines anymore. Was your decision to kind of switch into a different line of medical field because you wanted to stay out of the, I guess the stream of COVIDiness that's around?
Oh
That's what
yeah,
I would have done. Yeah.
we're not for
Well,
2 weeks. I'm like, oh, I was done.
yeah. Yeah, it was tough. Plus, you know what? You got a husband there you got to take care of. You got two kids and a pooch. You got two dogs, right?
2 dogs. Yep.
Yeah. See, you can't get sick. You gotta take care of all those guys.
Did you guys ever run into the we watch the news, and especially from Hawaii, like we don't we're kind of shielded away from all the mainland stuff. Did you guys ever run into the issue of the ventilator thing or the running out of PPEs that all the
Hmm.
the major news station, was it like that ever at your hospital?
Yep. We did for us. I don't know about you guys.
We did not run out of ventilators early on. I think we were close, where pretty much the majority were in use. We had to rent ventilators from a few facilities. and we came close to the capacity for our ICU. So,
Oh man.
and
No,
PPE, we were pretty well supplied throughout.
now I understand that ventilators are not entirely used like they were like early on in the pandemic. I heard that was like one of those things where that's why they're like, oh, we need 100,000 ventilators ASAP. Like everyone was like talking about that, but now you don't really hear about that because that's not. Has that process changed? Do you know anything about that?
Yeah, well, so early on, we were really aggressive in using the ventilators um, for patients that, in order to prevent infection, because we weren't really sure how infectious it was. And we were using what we call, we were using non-invasive ventilation techniques, and there was some concern that we would be aerosolizing a lot of virus, and so exposing a lot of healthcare workers and staff to COVID virus.
So they had a pivot.
Right. So traditionally, we would use the more non-invasive techniques, and before you would intubate somebody. So, but initially we were pretty aggressive in doing those things, and intubating and putting people on ventilators. So,
and then it turns out it works better in the process, right?
yeah. So it was eventually we've kind of realized it wasn't as infectious to use the ventilation, and in some cases it's probably more effective, and that patients could stay mobile. We could do some of the proning techniques without ventilating them, and that's really helped us manage those patients. So, and helping us get some better outcomes. So.
Yeah, man.
You said proning techniques. Yeah. What is that exactly?
So, one of the things we figured out early on is that traditionally you put a breathing tube in, or patient's sick, they're laying on their back in the hospital. You may put the bed up, but they're laying on their back. And with proning techniques, they actually are flipping these patients on their side, or even truly prone, they're face down. So they may have a breathing tube in, and they're laying face down on the bed with this tube kind of coming out a port in the bottom.
Oh shit!
Is that for whatever reason, the way that the virus is affecting their lungs, if they can actually change their position, they start to use some areas of their lung that they weren't perfusing before, and so they actually are able to improve their oxygenation and their breathing.
Oh man!
Oh wow! Okay, I've never heard that.
Yeah, that was hard because I was working. Those doctors never flip them on their stomach. All nurses do.
All nurses have to do that. They have to do the actual like.
Yes, they're
literal heavy lifting.
Yeah, most of them that are intubated are heavy. They're like 300 pounds to 350.
I do. And Rose, COVID or not, that is one of the 10 years ago, that was always something that nurses would always complain about or gripe about is, no, doctors don't do the heavy lifting. We're the ones who have to carry the patients, like lift them out of the bed. We're the ones who have to do that. So no, I get that.
Imagine you have to lift them, turn them. They have multiple IVs. They have a breathing tube in. They can't dislodge. So it's a pretty lengthy, difficult process.
Taking more than two people sometimes.
Yeah.
Oh yeah, probably. You need more than two. Plus, you have all these PPE, and you're like, I'm gonna die tomorrow.
You're in a spacesuit. Yeah.
That's right. Wow.
Yeah, I'm like, all right, they're spreading all that germs on me. I'm gonna have COVID tomorrow.
Yeah. Okay.
Did you guys get vaccinated yet?
Yeah, both of us.
Oh.
Last week.
Oh, that was right away, huh?
That means you guys will turn in like 7 days. That's a zombie joke.
So and then we're getting our second one in January. I'm getting it in a week and a half.
Yeah,
so.
There's two?
There's two for both Moderna and Pfizer.
Wait, you got to get both of them?
Well, no, one or the other. But there's two series. one boost, one
Did you
regular booster.
did you personally have a preference? I mean, were you like, well,
No, we didn't have a choice. Our hospital determines what we get.
and they probably wanted you to get the first one available, right?
The Pfizer one, that was even before the Moderna one had been okayed for use. So
Okay. And just
since
oh yeah, go ahead, Lance.
Since we're talking about the vaccine, I might as well just bring up the questions that I put out questions out there on my Facebook page, and I just said, hey, if anyone has a question that everyone gets their information from different places, and I'm sure they don't have access to people like you. So Denise Farias, she's asking, is the COVID-19 vaccine like a flu shot where you need to take it annually to stay protected, or is it a one-time and you're good?
well, it's a 2-series vaccine. As far as whether we will need it in series, we really have no idea. We don't know how long the immunity is going to last. We don't know what's going to happen with the virus. So really, we can't say for sure right now.
Yeah. I hear that the well, from what I hear, it's like it's my normal podcast of news that the strain that we hear in the UK, that mutated strain, that we shouldn't actually worry about it because this is just basically what viruses do, right? They just mutate over and over again, and our current vaccination should protect against that should it happen to come over here, from what I hear.
Yeah. So currently they think that the current vaccine will be effective in controlling that mutation. In theory, there mutation that could occur that would make one or even both of the vaccines not as effective. So although they're both targeted, the 2 vaccines are targeted at different proteins. So if a mutation happened on one that somehow made the vaccine less effective, it probably wouldn't affect the efficacy of the other vaccine. So, but as of right now, it's going to have an effect.
The second question is from Melanie Hornstein. She was asking, the vaccines got approval for emergency use, but how certain are they that they are effective with just minimal side effects?
Well, the original studies had about 50,000 patients in them, so and there really weren't any toxic side effects. Ideally, they would have tested it for longer on more people, but in the current state, that everybody agreed that it's probably the risks of the vaccine are a lot smaller than the actual infection itself. So.
Quote unquote Fauci.
Yep.
That's what he said, right? Yep. So, all right. Yeah. Now here's one question. So I know that there's a lot of I'm not even sure why it's maybe you can help me figure it out, because I'm not kind of a dummy about these things, but I'm not sure why how we count deaths is a big deal. I mean, when I mean deaths, I mean deaths related to COVID. So I know, I'm like, when I was looking at the CDC site, I guess numbers from each state are absolutely different, especially from what media reports. So I mean, I know that death certificates take time to be completed. I also know that different states report at different rates, and I guess it takes extra time to code COVID deaths. Do you know anything? I mean, do you have any idea, or like on why why it's important to figure out how many we're getting from COVID, but also why is it important, basically, to real pinpoint?
Right.
Yeah.
I don't. I'm not involved in the process,
Yeah.
of determining a cause of death, and I don't know how a coroner goes about counting those.
Yeah.
I think certainly the majority of patients that we're aware of that die from COVID, there's not much question as to the fact that they're at least dying in part due to COVID. These are patients that were admitted to the hospital, have a diagnosis of COVID that's been verified, have a pneumonia or some process in their body that's occurring that is an effect of COVID. And yes,
Yeah.
the patients a lot of times have, other comorbidities, diabetes, obesity, kidney failure. That's part of the process. But these patients are dying directly from COVID. Yeah, their body is failing from COVID.
Yeah.
So how much some of those other things are,
A factor.
yeah, are a factor or exaggerated, I can't comment on that.
Yeah.
I think it's really part of the process. But
Yeah. But our deaths in the hospital that are from the COVID units, our coroner won't even open them up. They don't want to touch them. They just said, okay, it's COVID. So
Oh, really?
they
Yeah.
don't. It's just
Actually, I've heard that.
they don't know what it's gonna. If it's is it gonna aerosolize? Is it gonna right? It's,
yeah.
they're
What's
like, no.
what's the benefit
point?
in
Yeah.
in doing autopsies on these 10 patients who are
Well, definitely died of COVID.
are died
when they're pretty sure.
Right.
Yeah.
I think that's the opening that why the famous podcasters like, I'll just say his name finally, Joe Rogan. Why I've always been trying to sidestep it, but yeah. So Joe Rogan and other podcasters where they're obviously, he knows he doesn't have a medical degree, but his influence is just so huge. But it's openings like that where they'll say, how come they don't do the autopsies? Or they'll say, well, they didn't do autopsies, so they don't know. And it's just because they don't know how impractical it might be.
Right.
Yeah.
And he's in his own bubble. I mean, $100 million guy, he doesn't understand that. Not that I do either, but I can understand that there's so many patients, you can't take your time because you have a whole slew of other patients coming in.
Mm-hmm.
Yeah. Oh, yeah. I'm actually looking at CDC right now. It says certifiers are asked to use their best medical judgment when it comes to death certificates. So yeah, that's their out right there. So
I think the most annoying thing is when Joe Rogan and other folks will say they don't know what they're doing, and I'm like, oh my god,
yeah, I know.
How can you say that?
Yeah.
It's like
then who
nobody
does?
knew what COVID was.
Then who does?
Most people didn't even know what COVID was before.
Yeah.
March.
Let them put on PPE and come in and prone some patients and spend some time watching people die, and they might understand the process a little better. But
yeah, there's actually a documentary that I think that's the one thing that I look up this stuff a lot and I don't see a lot of in hospital footage, and I think if they did, people will realize how how crazy it is. And there's a Chinese documentary that I think Vice made. I'm not sure. I had it on my list, but they're in China for the first like 3 or 4 months, and they show the chaos on, everyone's trying to figure it out. Everyone's blaming China, but they're just like, hey, we're trying to figure this out too.
Yeah.
Yeah. And I just saw the preview and I was like, oh man, like I wish more people saw this and realized that behind all the numbers, there's people working hard trying to keep people alive, and they can't be concerned with what a podcaster is saying,
Yeah. And then this is going on, our little hospital, this is going on
everywhere.
Every hospital all over the country, all over the world. So, we've got a 400 bed hospital that's got, maybe 100 to 120 COVID patients in it. And it's been like that for months.
Oh man. What's the average time that somebody spends actually at some of the hospitals that you know of? What's the average time that people actually spend recovering in hospital in the Midwest?
Well, boy, so the majority of patients probably are
7 to 14 days.
probably around a week. So they're coming in.
From the medical store.
Yeah, so they're the ones that aren't as sick that are maybe on some oxygen, getting some medications. They're in and out in a week, and then another week to recover at home. But the patients that are getting profoundly ill,
the one that's intubated,
they're
there for a long time. We had one that's like 45 days. He was 23 years old.
He was 23 years old.
He was heavy. He had disease. He was like 350 pounds. So.
That's the other issue. Sorry, I keep on bringing Joe Rogan, but I mean,
He wants to make
It's
sure.
already suggested on my note.
Health-
Well, I just want to make sure because like a
Healthy.
lot of us are listening to it, and one of the things that he keeps on saying is work out, which I think is ridiculous. I mean, obviously, yeah, it makes you healthier, but he's like, work out and take vitamin D, and you'll be okay. He's like, how come doctors aren't saying that? And I'm
Well,
like, yeah, dude,
Paul,
you'll probably be healthier if you do that. Not trying to get COVID, just in general.
yeah,
right?
you're actually talking now, Paul. I know you're more than likely to agree with that, just because you're a very practical gentleman, but you're also conscious of staying fit. As long as I've known you, you've always been exercising or promoting exercise. At one point, Lance, you're gonna love this. At one point, I own a restaurant in Chicago, and I remember I was not sleeping, and it was just like this unhealthy environment, and this crazy massage therapist said, "Oh, you shouldn't work out. You're 35 years old. Don't lift heavy weights." And when I asked Paul that, I was just like, "No, I think you're okay to lift heavy weights. Who is this guy?" So Paul's a guy who you're pretty much you promote being healthy and working out quite often, right?
Absolutely, both of us. But yeah, I don't think there's anything wrong with promoting that idea. I don't, clearly it's not a treatment for COVID, but
I think that's the issue is
Yeah.
that he makes it sound like
A prescription.
if you are, yeah, or like if you're generally healthier and you take vitamin D, you're less likely to die, which I would assume is true. But he's making it sound like that is the end all be all. If you're 23
That's the vaccine.
or whatever, you're
Vitamin D.
healthy.
That's the vaccine.
You take vitamin D pills, that there's no chance that you will get it and or die from it.
Right.
And it's
Probably
just like, what?
I've been working out and taking a lot of vitamin D's. I sell
Yeah.
them too. I give shots.
Honestly, we do. We take vitamins. We take vitamin D. Is there really data that supports it? No, there isn't.
Yeah.
So, but
It's just like a safe, like an extra layer of.
But we do
protection,
use
I guess.
that in the hospital. We use vitamin C. We used to give that by pills. And then I think we gave vitamin D and zinc. That's what we give in the hospital.
Oh, okay. Zinc is okay.
Yeah.
Yeah, I forgot to mention zinc. He says zinc
yeah,
a lot.
yeah.
Joe Rogan would go, "Oh, zinc. Got to
Yeah,
zinc." He's like, "How come doctors?" And that's another thing too. Is he says, "How come doctors don't?" He's like, "How come doctors never give vitamin D and zinc?" But you guys are saying that you do.
You do.
We're trying everything just to see what works. So. He's like, all right, just throw everything. Throw everything.
They cost pennies. It's they don't necessarily consider them a major part of their treatment, but they do include it as part of the treatment.
Yeah, we did. Yeah.
So, but will they save your life? It's probably not the biggest factor, but
yeah,
right. But it's something.
Absolutely, absolutely.
Man, I love seeing I love seeing you guys like talking about work stuff sitting next to each other. I love that. That's pretty cool.
No.
I like seeing that. That kind of reminds me of Rose, you watch Grey's Anatomy, right?
A long time ago. I saw like a couple episodes. It's bullshit. It's like it's not real.
Yeah. They've delved into the COVID world now. With,
really?
Yeah. In fact, I think I don't even know the name of the lead doctor, right? But
Gray.
is that why they call it Grey's Anatomy? Dr. Anatomy. I hear that she's supposed to contract it, and maybe that's her last season. So.
Oh, they're gonna kill her finally.
Yeah. Well, so let me ask you this. So actually, when you said that's bullshit, are you talking about like relationships in the workplace, or are you talking about like how they actually operate on TV shows? It's like that's not how it is.
The relation's pretty accurate, actually.
Yeah. Oh,
we
yeah.
did meet We did meet in the hospital, but
No,
but
it's just how they operate when they're like, all right, they're in the emergency room. Okay, we're gonna go to the OR. We're like, you don't have room in the OR right now. You take that patient now. You haven't even called the OR department to see if they even have a bed. They're operating. We can't take that patient in 2 seconds. Like, yeah, okay, whatever. Or like, oh, we're gonna amputate that leg. I'm like, where are you gonna do that at? The OR is not. It's in use, so it's like, oh, okay. Or just doing other things, and now I'm like, yeah, okay, they're all bullshit. Calling out with laugh. Like, who are they consulting, right? It's like, who are they consulting for these shows? And there's no Filipinos in there. Come on.
I know.
That is
right there.
There are Filipino nurses in the hospital.
I know. It should be Mary Tess's Anatomy. That's what the show should be. I can see just Rose like sitting on the couch like this, watching it, like bullshit. No bullshit. Well, Paul, you just said, Paul. I like how Paul said that. You guys did meet in the hospital, though, right?
we did.
You did.
So Rosie was just finishing nursing school, and I was just starting my first job. So
Out of residency.
I had just finished residency. I was starting my first job. So, and
That's awesome.
I'm pretty sure I remember that. I remember that.
I don't think so.
I do remember that.
You're between whatever.
No. That was way before then. I was in a completely, still trying to.
That was a different one. Yes. Never mind. That was like 1,000 years ago, Carl. I can't remember. You're too old.
What? How? No, you're what? How?
How old am I? 29.
No. What wedding anniversary did you two recently celebrate?
I'm only 29, so.
So second one then.
That's not true. That's not true. You can't lie on a podcast. You can't lie.
we are
19?
18.
18? That's a long time ago. So.
That's awesome, though. I love hearing that.
That is awesome.
How? So, okay.
11. We got married.
See, so there is some truth to Grey's Anatomy, right? Just a little bit. Just a little bit.
Yeah. Something.
Yeah, there's a few that meet in the hospital.
Yeah.
We were lucky enough.
That's not frowned upon in the hospital.
No, because I was doing my rotation, my clinical, so I wasn't working with them.
All right.
Okay.
Carl, do you have any movies that you want to ask them about the COVID relation?
Yeah.
Possibility?
Well, let's. You know what? I don't. They're not really. I mean, Paul's not really a movie guy, but 28 days later.
Have you guys seen that?
I think I did.
28 days later is a take on a virus called rage, and once it hits your bloodstream, you got how long was it? 1 minute? Is it 1 minute, Lance?
Oh yes, that's
something like that.
It's a Danny Boyle film, but you get like a very short amount of time before that thing takes over, and in essence, you're basically a raging zombie.
I haven't even heard of the movie.
Oh yeah, it's pretty old with some great footage of London, like completely barren, like with nobody in it. I don't even know how they got those shots.
It was one of the first movies where you saw zombies run, and that was the scary part.
Yeah,
they weren't just like trotting along. If you made noise and they saw you, they were chasing after you and running.
Yeah,
and I remember
Yeah.
No, go ahead.
Yeah, it's not, and they're not. So Danny Boyle revolutionized the zombie genre in the sense that, it's like Lance said, it's not like you're dead and then you're like brains. It's you become angry and you want to
your brain swells apparently.
Yeah, and you want to rip apart the first person you see. That's normal.
Yeah, that sounds like it could actually potentially be realistic, like a rabies in humans. So
Right.
yeah.
Right. There's actually I've heard it's called, oh man, Carl, maybe you've heard of it or you guys are familiar. It's like a deer disease. This sounds really strange, but apparently it talked about it on Joe Rogan's podcast. I've seen it in other
Deer.
places. It's like a deer disease. Yeah, it's a deer disease, and they're afraid that it could actually go over to humans. And it's God, I gotta look it up. I should have looked it up before this, but it apparently people are kind of concerned. But if it ever did, it would be pretty crazy. I just don't. I think the thing is, it is deadly,
Okay.
but but it's not like super infectious. I think that's
So I just looked up deer disease, and it says, as of July 2020, chronic wasting disease. Is that it?
that's it. That's it.
Chronic
Yeah,
wasting disease has been detected in free-ranging cervids and or captive cervids. Is that a deer? Is that the technical word for deer? Cervid?
I think it's a type of deer.
Yeah. Chronic wasting disease. No, nothing, Paul.
Mm-mm.
No.
I mean, that's good. That's good.
Don't get a lot.
It's much better than, oh yeah, we got 5 cases last.
We don't get a lot of chronic wasting disease in the Midwest.
But because they were talking about hunting and
I think it's just in deer, like you said. Yeah.
yeah, but they're I think the concern was with, hunting and possibly eating one of these deer and then, starting that cycle, that scary cycle. But yeah, I mean, I remember when COVID first came out, I was like, oh, here it is. Here
Yeah.
is our 28 days later. And then after it, I mean, obviously when we learned that it wasn't that, I was like, wow, if it was and people were taking it like how they're taking it with not wearing a mask and going out and doing whatever, it wouldn't be long before all of us were walking around with swollen brains trying to eat other people. And then there's like a movie, the older movie Outbreak, Carl.
Oh yeah,
I
with
don't know
the
if you guys seen
monkey
that.
and Dustin Hoffman.
Yeah, and I mean, if I remember correctly, isn't that kind of they eat the monkey, right?
Yeah, I think the country eats the monkey, and then I think it's Dustin Hoffman who's like the Fauci, the young Fauci, I guess. It's his job to try and find that monkey. They had to find that specific monkey to create the vaccine. So obviously, we've learned now that we don't have to do that, right? We don't have to find patient zero.
I think we saw that movie, but it was pretty forgettable.
And it was a long time ago too.
Yeah.
So what can I have a question really quick? So I understand that I'm going to talk about Ebola. We had an Ebola outbreak a couple years ago, I believe.
Mm-hmm.
So from my understanding, Ebola is a lot more lethal, if I'm thinking correctly. It's just less contagious. Now, has there ever been a disease that is as lethal as Ebola, but as infectious as COVID throughout history that you can think of, or like relatively the same?
Boy, not my field. Medical history is certainly not my field of expertise. Certainly the 1918 influenza epidemic, probably the mortality was probably going to end up was higher than the current COVID infection. So as far as the number of patients that got, percentage of patients that were infected, the percentage that died was probably higher. Now, maybe that was due to kind of a lack of access to medical care, nutrition, but
Communication too, right?
Yeah,
Mm-hmm.
absolutely.
Yeah.
So, and probably not as infectious as COVID. Influenza is very infectious, but as we're figuring out, COVID is very infectious. And continues to be. Despite social distancing, despite masks, it's pretty infectious virus.
Yeah. I can imagine, Paul, that you have a pretty amazing bedside manner with all of your patients. I mean, being a great guy and all, but what's the one thing that you always impart to your patients as you bid them farewell, or if you know that they're going to be spending some time in the hospital? Like, is there something that you have like a Dr. Paul Faine catchphrase, like we'll be seeing you. Don't get, an apple a day, something.
Nobody
right?
points a finger gun to their patient. I don't
You
think
know,
that's a thing.
I'm sure that one of them do. Some of them do. What if there's a syringe in there? Like this could be a syringe, right?
We've, with the patients that we've been admitting to the hospital with COVID, when they realize that they're staying and they realize that they're pretty sick,
Yeah.
they're pretty scared.
Yeah.
So
I can imagine.
I tried to warn them that, hey, you're going to be spending a lot of time by yourself because they don't get visitors. The nurses don't spend a lot of time in the room because come in, help them with something, and then they leave because they don't want to sit there right next to them the whole time.
Right.
So I just impart to them, hey, it's going to be lonely, it's going to be difficult, but we're going to get them through it.
Yeah. That's I'm sure those words go a long way too, Paul. Not like me. I'd be like, hey, do you have a Game Boy or something?
No, it's for
Game Boy. Game Boy.
You gotta
1992. PlayStation 5.
Switch.
Man. 5.
Yeah. So anyway, Paul, Rosie, are there any parting thoughts? Maybe a couple of stories or something. Anything that you'd like to say, before we sign off for the evening?
Here I have a question.
Oh,
or not
still,
question. But, do you guys have? It's not really a question, or maybe it is. Do you have any? So we hear a lot of, dine inside with your mask, it's fine. Down outside, it's fine. You can travel, it's fine. Like all the. Do you guys have any general you can do it, but it's probably not the best thing to do, or vice versa? You know what I mean? Like, because, and I'll tell you this because it's all over the place. You have some states that are like dining outside's fine. You have other one dining inside's probably not great. And I know there's probably not a definitive answer, and you may not have an answer that you can be 100% behind. But are there any general things that you could say are probably good, okay to do, and some that are you might want to be more careful? Sorry to put you on the spot, but
you do it.
I'd much rather hear it from you than Joe Rogan. I'll put it that way.
Well, I think the idea that you have to disinfect all these surfaces is probably way overdone. I don't think you're probably getting contaminated and infected by touching a countertop or touching.
Oh, I gotta tell my mom that she won't go anywhere without her disinfectant wet wipes and.
Right.
Mainly, Paul, because you're saying it's mainly if you're going to get it, it's through droplets in the air.
Yeah, and I think generally it's going to take prolonged contact within at least 2 to 3 feet with that person. Most of that you become aware of. Somebody was in a car with somebody or at a party or working with somebody, and they were in close contact, and they spent considerable time like that without one or both of them having masks on. So.
And then if you're for instance, if you're in a room or in a car with people and everyone has a mask on, is it better to have the windows in the room or the car closed? Or do you want the air to be flowing through with the windows down?
Those are real questions. I know that.
I mean, that's a real question because
my wife and I have these debates because my wife will no, if you open the window, you're circulating disease around. I'm like, no, you're letting fresh air in, and it's probably going to be blowing out the window anyway if there's some lingering.
Right.
Well, boy, ideally, you're not going to be sharing a car with people outside your family.
Right.
But I mean, it certainly is more logical that you have to have the windows open, to have it vented. You're going to have more airflow, less viral particles.
Let me note that. Okay, no, that's helpful because I've heard the argument on both sides.
I know.
You don't want to have the air moving, and
I've had people, ask well, what if you have cuts on your hand and you're touching a surface? I mean, I'm not sure.
almost all respiratory droplets, so I
Yeah.
don't think contacts are going to make a difference.
Yeah.
As for restaurants, they certainly are a potential source to get infected. You're spending a lot of time with your mask off.
Yeah.
Then your people are passing by. You're in contact with your waiters. I think the restaurants have done a really good job trying to minimize contact, having you use, scanning in menus and doing those things. I think it's been pretty effective to allow us to at least go out a little bit. But,
Yeah, some kind of normalcy, huh?
yeah.
All right.
Yeah. Well, thank you, because those are questions that have been burning me inside, and my only solace in hearing these people say this is reading the comments and people going like, I think he's wrong, and I'm like, yeah, I think he's wrong too, but obviously they're not doctors and nurses, so thank you for that.
Yeah. So Paul and Rosie, thanks again for joining us and kind of giving us a little bit of a glimpse into your work life, and in the ER, and you, Rosie, and now in what are you doing now? You're doing
Plastic.
plastic
Facelift.
facelifts.
Tummy tuck. Breast implants.
Oh, so you work with the Kardashians? Is that true? Or?
Of course, no. Fillers, Botox, all those stuff.
And that industry hasn't been hindered at all, has it?
Yeah. We're more busy because people don't go anywhere, so they don't know what to do with their money.
Yeah.
So
they get enhancements.
You know what? Not to get totally off track, but I did a photo shoot for a doctor's office here.
Yeah.
And it was for Botox.
Okay.
And I had never seen anyone take, and it was shocking to me how the girl just stood there and smiled, and she just has the needle just going into her face like it was nothing. Like, I mean, obviously she had done it before, but I was like, wow, this is a whole new world for me.
They're small needles, so I'm sure
it's still a needle in your face. I'm sure.
So Rose, what is the strangest, really quick, what is the strangest request that you've seen so far at your workplace?
Labiaplasty.
A what?
It's the. Can you explain what labiaplasty?
No, you brought it up.
Oh, okay.
What
is it? Something reconstructive surgery
for labia minora, labia majora, taking off the flaps?
Yeah,
tucking them and making them nice little curtains.
It's big, so it is a curtain.
Yeah.
So they have to cut it to make it smaller.
Oh, I see. Yeah. It's like a carpet, and they need to make it into nice tailored. Yeah, I see. Okay. What?
There's such a thing. And then my doctor's like, you need to come and help me in there. I'm like, what do you need there? Oh, I gotta take the stitches out of her vagina. So I'm like, oh, okay.
Wow, this took a turn.
So
that's weird.
is that do you know if that's like, do people actually like claim that there could be a real problem? Like, I need to get these trimmed because they keep getting caught in like my bike spokes or something. Like, do people like really?
The last one we just did, she really had a significant amount of excess. It's like a extra ear.
Yeah, just kind of extra tissue.
And it was hurting her when she does, she goes for a bike ride and stuff like that.
Yeah.
It was just cosmetic, so.
Yeah.
They just wanted to look pretty.
And then whenever the wind blows really hard, it sounds like a sailboat sail. That could be embarrassing for a lot of people. Hey, well, thanks for sharing. That's kind of fun. I maybe like to talk to you more about that later. It's kind of fun.
Yeah,
it's kind of fun.
Well, thanks for joining us.
Yeah,
seriously, this was super informative.
And I know it's late over there, so appreciate taking your time. So, and
you're welcome.
Now you can go play with your dogs. Now they're probably like, "Mom, Dad, play with me."
Yeah, they're playing whatever.
Yeah, they're on their computer games.
Yeah.
What, the dogs?
The dogs too, yes.
Yeah.
All right, guys. Thanks again, and have a great and safe New Year. And we appreciate all of the work that you're doing on the front lines there, Paul and Rosie. keeping the Midwest safe and healthy, and at least being that line that helps keep people less scared if they happen to do catch it. So
You're welcome.
Thank you guys.
Thank you, guys.
have a good
Bye.
night.
Bye, guys.